Everyone who has cataract surgery has a surgery in which we're removing the natural crystalline lens inside the eye, and therefore we have to replace that with some type of lens implant in order for them to see. And those lens implants have a power. It's customized for each patient based on the measurements we take in here and in the OR. In general terms, we have 4 different options on the lens implants. And these lens implants are amazing. These have the ability to give people incredible vision and restore youthful vision. And we'll talk about each one of those. But the 4 broad categories of lenses are the standard monofocal lens, which we call it the standard lens because it's appropriate for any patient. Also, it is covered by insurance, and it's generally going to provide that patient one level of vision. It's called monofocal, which means it has one focal point. And for the most part, we use these when we're trying to give a patient distance vision. And then the plan would be for them to have distance vision and wear readers for up close or bifocals. Occasionally a person may say, well, I had LASIK and had one eye distance, one eye near, or I wore contacts with what we call mono vision, one eye distance, one eye near. We can also accomplish that with this standard lens. Many times we'll say, well, distance vision is great, but can I have a range of vision to allow me to see distance and near without glasses? And for that, we have this lens. This is called a multifocal, and you can see by the concentric rings in there, it splits the light into 3 different focal points. And the scientists over the years have gotten better and better with this technology. With the current version of the multifocal that we're using now, we have tremendous success. The optical science behind it has improved to the point where the incidence of halo is actually quite low. Probably 90% of my patients tell me they don't see halos after the first month, and then about 10% report some halos, and less than 5% would rate those halos as problematic. If a person has a lot of astigmatism, there's a separate lens for that, and that would be this lens. This lens is called the toric lens. Toric indicates that it has astigmatism correction. It has astigmatism correction built into it, and we very carefully align these marks with the axis of astigmatism that we measure, both in the office and in the OR. And so for someone with high levels of astigmatism, we would recommend the toric lens. There is one other option on lens implants that we have that is also very, very advanced, and probably the most advanced technology for lens implants in the world. And it's called the light adjustable lens. The light adjustable lens is a lens that we can place inside the eye at the time of surgery. We know we're going to be very close to spot on, but it's the only lens that we can then bring the patient back here into the office about 3 weeks after the second eye. And we actually have a machine that will fine tune and adjust the power of that lens using ultraviolet light. And that's amazing. That sounds like science fiction, but it's real, and we have it. And we have participated in an FDA study regarding that lens, and we have incredible results actually with all of these lenses. So it will be something for patients to think about and consider, and hopefully inform themselves a little bit before they come in for their consult. But we have tremendous technology, and we have something really to help everyone.